kids, and it's just easier to order on the web anyway if you have that access from home. It's an elastic knitted fabric that's used for making undergarments for our usages in baby clothes, but originally another product that was designed for something else that we've adapted in peds. It was originally designed for orthopedics. Okay. This is a onesie. In other words, it's a long t-shirt that snaps in the crotch. Okay. Other common problems, skin care. It's really not too cumbersome to do. There's daily care, cleansing around the site. The body normally tries to close up this hole that somebody put in the skin and the tissue. So it's normal for there to be a moist mucus that is produced and also some granular tissue. But these can be controlled just by daily taking care of them and also going into the surgical clinic and having the physician or nurse practitioner use a little silver nitrate to keep the granular tissue under control. Daily care also includes turning the tube inside just like a quarter turn. If you imagined a clock face on the baby's abdomen and you just went from 12 o'clock to 3 o'clock, 3 o'clock to 6 o'clock or whatever, then whatever your surgeon has advised for securing, whether it's taping directly to the abdomen or using a little gauze bolster, and those you can usually change with every cleaning. Creams and ointments, you need to talk to the surgeon or the nurse practitioner for what that G-tube is made out of. The older latex tubes, which of course are the cheaper ones, are made of latex, and they are subject to breakdown because that's a rubber product. The newer Foleys are made out of silicone, so you don't have as much problem. So when you're using creams or ointments around that, the ointment can actually break it down. Home remedies, you can see more lists of testimonials to different products on the website, including what I have heard most often from home care nurses. When the tube gets plugged, a little Coca-Cola, like a teaspoon down the tube, kind of clears up the plugging. And there's a fight between whether it needs to be Diet Coke or real Coke, whether you can use Pepsi or not. I would say talk to somebody who's done it before, and by all means use your surgical clinic caretakers to help you decide what to use. But some of that can be prevented, and we'll get into that just a little bit. Infections. Anytime you see redness, it might just be irritation, but it could be an infection, especially if it's red and starts to look a little swollen. You might be able to get away with a topical antibiotic. You might have to have your child put on systemic antibiotics, in other words, taking pills or liquid through the tube. But most of this can be prevented too by just good daily care. You can have a fungal infection, which is little separate dots around the redness on the skin, or if there is any kind of mucus produced, get your nose down close, give that baby a little kiss on his tummy, and smell it. If it has a smell to it, it may be pus, it may be infection and a sign of antibiotics. Now, I don't want to scare anybody, but this is the worst that can happen after the tube popping out on you when you didn't want it to. Again, most of this can be prevented. Bathing, I wanted to mention before I go a little further. Once a tube hole has matured, so after that 2-week period, your baby can go into a full bath, can go swimming, mommy and me classes, not a problem. Okay. Granulation is a soft pink tissue. Any of you have scraped any area on your body and watched the scab come off and that pink tissue that's there, that's granulation. Again, the body's trying to close that hole even though there's something in the way, so it will overproduce that extra tissue. And you need to, again, regularly go to your clinic, your surgical clinic, follow up, and they have silver nitrate. It's a prescription item on a stick that slowly, and this sounds awful, burns that tissue, but there's no nerve endings in that tissue, so it really doesn't hurt. Okay? This is a questionable infection, and somebody has tried a little iodine on it. Stay away from iodine in kids. Iodine absorbed in the body in excessive amounts can have some neurological problems. Again, if you can't figure it out, if daily cleaning is a problem, go in and see your surgical clinic early and let them look at it. Leaks. At the stoma opening itself, one of the good things about having a G-tube is it actually helps you get the nutrition into this child on a consistent basis so the baby starts to grow. So there may be a normal growth process going on, and the tube, of course, stays the same size. So what is usually recommended is monthly or every 2 months replacement of the tube in general. The body will also try to digest the inside part of that tube, so things will start to break down if you let it go much beyond a month or two. That needs to be done at the surgical clinic or your pediatrician's office. You may have a disconnect at the feeding tube. The rubber band is a great device. You just, on the Foley's, just fold the tube in half and wrap the rubber band around, and then you've got your own clamp. It's nice and soft for the baby to lay on too, instead of that hard plastic push clamp. If the internal valve or the internal balloon is a problem, you probably need to go have the whole tube replaced. One of the things we recommend in the NICU is on a weekly basis, all the nurses withdraw how much water is in the bubble, in the balloon, and see if it has gone down, and then replace it, because there can be a slow leak on the bubble. You never know. But it isn't an urgent thing to be replaced unless when you pull back and there is no water coming back. Then you've got a very big leak and probably need to get it replaced. Tube migration, again, the stomach tries to churn, like you think about all of our noises our stomach makes when we eat something really good, and tries to process that as a food item and bring it on down into the intestines. So what we also recommend on a weekly basis is get out a measuring tape and get used to how much of that tube is supposed to stay on the outside. I'm talking particularly about Foley's. When you've got the button, it's pretty obvious where it's going. Plugging or clogging. Usually prevention is the best idea, and that is to flush after every feeding or after you give medications with a small amount of air and water. Okay, we're talking 3 to 5 mLs or a teaspoon of water to clear that out. Some of the remedies that I have heard about, and talk with your surgeon or nurse practitioner, what they think is really the best thing is Coca-Cola, seltzer, a little meat tenderizer mixed in water, and even baking soda. Caution, don't use too much of this stuff, because as baking soda is, it's got a lot of sodium in it. So I would consult with somebody before you start making your own little home remedy. Here's some of my resources. In Spanish and in English, I was able to find some home care instructions from the great facility, Cincinnati Children's Hospital in Ohio. They always have good information on their websites. And I also found a very interesting website from parents who are supporting children with hydrocephalus. And they had a lot of suggestions about caring for and what's worked for them for G-tubes. Some more resources would be to go to the manufacturer. As I found out, I thought Mickey was still with the Bard Company, and it's gone with Kimberly-Clark now. So you really need to stay up with who's bought what for replacing your equipment out there. Knowing how the economy is, you know that things are being bought up in all kinds of ways. But thanks to the internet, if you just use the word Mickey or whatever it was called before, Foley catheter, you usually can find the trail where it goes. Stockinette is available from the Comfort Company, and this is their full email address for ordering that. And I believe that's the end of my presentation, and I will be waiting for questions.
Okay, we're looking at doing our questions at the end.
Okay.
Okay?
That'll be fine.
This is the off-screen person behind the... So we're going to wait for our questions off-screen, and we're going to wait for our questions after Sarah's presentation. And once again, maybe Olivia could do a little in-service here and show you how you can access your chat box and then she'll do she'll add voice to it too.
Hi there, and for those that are tuning in, my name is Olivia, but you'll see the name under my picture is Yvette Baptiste. She's the chairperson